Today, we're going to uncover the secrets behind 5 essential vitamins and minerals that every person with diabetes shouldn't overlook. Did you know that just a deficiency in a few key nutrients can make blood sugar management much more challenging? But don't worry. This video will show you why these vitamins are your secret weapons in maintaining your health and keeping your blood sugar levels stable. And that's not all. If you stick around until the end, we'll share some simple tips on how to naturally boost these nutrients using the foods you already love. So, what are you waiting for? Let's dive in and discover how to optimize your health right now. If you found any particular vitamin to be especially effective, don't hesitate to share your experience in the comments below. Let's get started. 1. Vitamin D. Vitamin D is not just a nutrient that strengthens bones. It's also a vital component in glucose metabolism and blood sugar regulation, especially for individuals with diabetes. What many people don't realize is that vitamin D can stimulate insulin secretion through its receptors located on the V cells of the pancreas. Insulin is a crucial hormone that regulates blood sugar levels. When the body is deficient in vitamin D, the function of these V cells declines, leading to impaired insulin production and an increased risk of diabetes. Additionally, vitamin D helps reduce insulin resistance, a key factor in type 2 diabetes. Research from Peking University has shown that supplementing with vitamin D can enhance insulin sensitivity, thereby improving blood sugar control and reducing the risk of serious complications. Moreover, vitamin D plays an important role in regulating immune responses and reducing chronic inflammation. Chronic inflammation not only contributes to insulin resistance, but also worsens high blood sugar levels in diabetic patients. By reducing systemic inflammation, vitamin D aids in more efficient metabolism and helps maintain stable blood sugar levels. Another noteworthy point is that vitamin D has a strong connection with calcium ions, which are essential for insulin secretion. When the body lacks vitamin D, calcium ion transport is disrupted, which decreases insulin production and exacerbates insulin resistance. This, in turn, accelerates the progression of diabetes and its related complications. The primary source of vitamin D is sunlight, as the skin produces vitamin D upon exposure to UV light. However, for people with diabetes, getting enough vitamin D from dietary sources is also important. Foods rich in vitamin D include fatty fish like salmon, mackerel, and tuna, egg yolks, mushrooms, and fortified dairy products or cereals. Therefore, if you want to effectively manage blood sugar levels and reduce the risk of complications, maintaining stable vitamin D levels is an essential strategy. Remember to consult with your doctor before starting any vitamin D supplements to ensure safety and effectiveness for your health. 2. Calcium. Studies show that individuals with type 2 diabetes are at a higher risk of calcium deficiency compared to the general population. Supplementing calcium through diet or supplements can help improve cell function and better support blood sugar control. Calcium-rich foods include milk, yogurt, kale, broccoli, and salmon. When combined with vitamin D, calcium absorption is enhanced, allowing the body to make the most of the calcium intake. The connection between diabetes and mineral metabolism is crucial. Poorly managed diabetes and high blood sugar levels can lead to the loss of calcium and phosphorus through urine. resulting in reduced bone density and an increased risk of osteoporosis. High blood sugar levels can severely weaken bone density, raising the risk of fractures. Conversely, maintaining normal blood sugar levels helps reduce urinary calcium loss, offering better bone protection. Calcium also plays a vital role in bone formation and resorption. In diabetic individuals, the function of mature bone cells is often impaired, slowing down the process of new bone formation. However, sufficient insulin levels can activate insulin receptors on mature bone cells, boosting their function and promoting the production of new cells. Lack of insulin in diabetic patients can negatively impact bone growth, leading to issues like decreased bone density and osteoporosis. Notably, there is a distinct difference in bone density between patients with type 1 and type 2 diabetes, especially in the lumbar spine and upper femur. In type 1 diabetes patients, bone density often declines significantly due to insulin deficiency during crucial bone development stages. This can result in complications related to bone health, particularly in younger patients. Maintaining stable levels of calcium and vitamin D is essential for diabetic patients, not only to support blood sugar management, but also to protect bone health and prevent osteoporosis and related complications. Be sure to consult your healthcare provider to ensure you are supplementing correctly, safely, and effectively, helping you enhance both your overall health and quality of life. 3. Vitamin B12. Vitamin B12 is an essential nutrient for overall health and is particularly crucial for individuals with type 2 diabetes. Its primary role is to maintain stable nerve function and support glucose metabolism, helping the body absorb sugar more effectively. A deficiency in vitamin B12 can impair nerve function, leading to symptoms such as tingling, numbness, and even peripheral neuropathy, a common complication among diabetic patients. Research indicates that people with type 2 diabetes are at a higher risk of vitamin B12 deficiency, especially those taking metformin. Metformin is a commonly prescribed medication for managing type 2 diabetes, but it is also a leading cause of B12 deficiency. A study from Yonsei University College of Medicine, South Korea, found that long-term use of metformin significantly increases the risk of vitamin B12 deficiency, which can lead to serious issues like megaloblastic anemia, damage to the white matter of the spinal cord and brain, and neurological symptoms. The American Diabetes Association, ADA, recommends that patients on metformin, particularly those exhibiting signs of neuropathy, undergo annual testing for vitamin B12 levels. This helps in early detection and timely intervention to prevent complications. To boost vitamin B12 intake, diabetic individuals can focus on consuming B12-rich foods such as beef liver, clams, dairy products, eggs, fish, chicken, and fortified cereals. Notably, vitamin B12 is not found in plant-based foods, so individuals following a vegan or vegetarian diet may need to rely on supplements or nutritional yeast to ensure adequate B12 intake. In summary, vitamin B12 not only plays a key role in maintaining nerve health, but also aids in effective blood sugar management and reduces the risk of nerve-related complications. Ensuring stable vitamin B12 levels is a vital part of comprehensive care for individuals with type 2 diabetes, contributing to better health outcomes and improved quality of life. 4. Magnesium. Magnesium is an essential mineral that plays a vital role in overall health, particularly for individuals with type 2 diabetes. This mineral not only supports cell function, but also helps stabilize blood sugar levels, improves insulin sensitivity, and aids in the regulation of glucose metabolism. Supplementing magnesium through diet or magnesium-rich foods like cashews, sunflower seeds, and peanuts can offer significant benefits for people with diabetes. Research shows that individuals who consume adequate magnesium have better blood sugar control and a reduced risk of developing type 2 diabetes. Conversely, low magnesium levels are associated with insulin resistance, a condition where the body produces insulin but not enough to meet its needs, leading to prolonged high blood sugar levels. A meta-analysis of 26 studies involving over 1,000 participants found that those who regularly consumed higher amounts of magnesium had a 22% lower risk of developing type 2 diabetes compared to those who consumed less. This indicates that magnesium supplementation can play an important role in preventing diabetes and improving glucose metabolism. Additionally, individuals with diabetes, especially those with insulin resistance, tend to lose more magnesium through urine, reducing the body's magnesium levels. This not only affects blood sugar control, but also increases the risk of magnesium deficiency, which can lead to complications related to the nervous and cardiovascular systems. Even those with prediabetes can benefit from magnesium supplementation, as it helps improve blood sugar levels and may prevent the progression to type 2 diabetes. A study published in the National Library of Medicine found that increasing magnesium intake can help reduce insulin resistance and improve blood sugar control. Specifically, every 50 milligrams increase in daily magnesium intake was associated with a 3% reduction in fasting blood sugar levels. This highlights magnesium's clear impact on metabolic health and its role in managing hyperglycemia. In conclusion, magnesium is a key mineral that helps reduce the risk of insulin resistance and supports blood sugar control in individuals with type 2 diabetes. To ensure sufficient magnesium intake, consider incorporating foods like nuts, whole grains, leafy greens, and fatty fish into your diet. Maintaining a magnesium-rich diet not only helps stabilize blood sugar levels, but also reduces the risk of diabetes-related complications, enhancing the quality of life for those managing the condition. 5. Vitamin B1. Vitamin B1, also known as thiamine, is a crucial nutrient that supports the function of many bodily systems, particularly for individuals with diabetes. A significant proportion of diabetic patients, both type 1 and type 2, often suffer from vitamin B1 deficiency, increasing their risk of developing nerve-related complications such as diabetic neuropathy. Thiamine plays an important role in carbohydrate metabolism, helping the body convert carbohydrates into energy and maintaining stable blood sugar levels. Additionally, vitamin B1 helps protect cells from the damaging effects of high blood glucose levels, reducing the potential harm caused by diabetes. Supplementing vitamin B1 is considered beneficial for most diabetic patients, as it helps lower the risk of nerve complications and enhances overall nerve function. According to research from King Saud University, Saudi Arabia, vitamin B1 supplementation not only addresses deficiency, but also improves lipid profiles, aiding in better cholesterol management and reducing the risk of cardiovascular diseases, a common complication of diabetes. However, It's important to note that supplements cannot fully replace diabetes medications. They serve as supportive measures in the comprehensive management of the condition. Beyond its protective effects on the nervous system, vitamin B1 has also been shown to help prevent kidney damage in type 2 diabetes patients. Research from the University of Warwick, UK, indicates that high-dose thiamine supplementation may help reduce the excessive excretion of a specific protein in the urine, thus minimizing kidney damage, a serious and common complication of diabetes. Diabetic individuals can increase their intake of vitamin B1 through their daily diet, consuming thiamine-rich foods such as asparagus, green beans, beef liver, sunflower seeds, mushrooms, pistachios, herring, and whole grain nuts. In cases of severe deficiency or high risk, thiamine supplements may be considered under a doctor's supervision. In summary, vitamin B1 is not only essential for overall health, but is also particularly vital in protecting the nervous system and preventing complications associated with diabetes. Adequate supplementation of vitamin B1 can offer numerous benefits, helping patients maintain a better quality of life and effectively manage their diabetes. And there you have it. We've just explored the 5 essential vitamins and minerals for anyone living with diabetes. As you've seen, each nutrient plays a vital role, from improving insulin sensitivity and supporting nerve function to helping maintain stable blood sugar levels. Incorporating these vitamins and minerals into your routine can not only help you manage diabetes more effectively, but also enhance your quality of life and reduce the risk of serious complications. If you found the information in this video helpful, don't forget to hit the like button and subscribe so you won't miss out on more valuable content. We'd love to hear from you. Have you tried supplementing with any of these vitamins? Share your thoughts and experiences in the comments below. Finally, remember that small changes in your diet and lifestyle can make a big difference in your health journey. Thank you for watching, and we look forward to seeing you in our next video. Stay healthy and live your best life every day.